7 signs that your kidneys need help. Dear viewers, have you ever encountered someone who is suffering from kidney failure? Or, how does it cause the problem without knowledge? Is there any specific indication or symptom? Don't worry, we've got you covered. You see, a healthy kidney is a key component of good health. It works as a filter to remove waste from the body. The blood passes through a network of 1 million tiny filters called nephrons. The blood enters the kidney through the renal arteries and flows out through the renal veins. Common, we all aware of that. Each nephron has a tiny filter called a glomerulus. Using this system, the kidneys maintain the balance of fluids, acids, and salts in the body. They produce several important hormones. These include erythropoietin, which tells the bone marrow to make red blood cells. Also, the kidneys control the body's calcium and phosphorus levels. Another important function of the kidney is to regulate blood pressure. People who have high blood pressure are more likely to have kidney problems. We have been receiving questions like, how do I know if my kidneys need help? What are the 3 early warning signs of kidney disease? What do weak kidneys feel like? How do you know if your kidneys are struggling? Now, we'll explore 7 signs that your kidney needs help. If you're facing the following issue, let's dive in, shall we? Hello dear viewers. Hope you're having a great day. Welcome to TKI, theknowledgeinsights.com. Being part of your fine lifestyle. Before we start, click the subscribe button below, also the bell icon, as we have more insights to share with you for your fine living. Let's get started. Number 1. Excessive fatigue, a sign of kidney disease. You see, fatigue is a common symptom in patients with kidney disease. It can cause problems with memory, concentration, and confusion. As disease progresses, fatigue can become worse. If you are experiencing excessive fatigue, talk to your doctor. There are interventions available to help you cope with this condition. The severity of fatigue is associated with various behavioral and psychological factors. Research in other patient populations has shown that cognitions are important. In advanced kidney disease, fatigue is a major symptom. God! It really affects approximately 42% to 89% of patients. However, the exact prevalence is unclear. Until now, no studies have systematically evaluated the association between fatigue and outcomes. Despite the importance of fatigue in advanced kidney disease, little is known about its treatment. In addition to pharmacological methods, non-pharmacological interventions have shown promise. Cognitive behavioral approaches have been effective in treating other long-term conditions. These interventions have proven useful in alleviating fatigue. Efforts to address unhelpful cognitive and behavioral patterns could be a key target in the intervention of fatigue in dialysis patients. Although anemia is one of the most common causes of fatigue, other causes include stress, poor sleep, and poor diet. Anemia is a condition in which the body is unable to produce enough red blood cells. This can lead to a decrease in oxygen to the brain. Other symptoms may include nausea, vomiting, mouth odor, and lack of appetite. Some studies have suggested that anemia can be treated by taking iron supplements. Kidney failure may also cause anemia, which can result in shortness of breath, trouble concentrating, and memory problems. Number 2. Shortness of breath is a symptom of kidney disease. If you've had shortness of breath for more than a few days, it may be an indication that your kidneys are not functioning well. You can get medical attention right away to find out why you're having trouble breathing ASAP. As mentioned, your kidneys also produce a hormone, erythropoietin, that tells the body to make oxygen-carrying red blood cells. In addition, your kidneys regulate the important salts and minerals in your blood. One of the earliest signs of kidney disease is an atypical level of creatinine and urea in your blood. This can lead to uremia, which causes bad breath and nausea. Another sign that your kidneys aren't functioning is that your skin may react with a red, irritated rash. Your doctor may order blood and urine tests to check for kidney damage. Other additional symptoms of kidney disease include low blood pressure, dry mouth, nausea, fatigue, and weight loss. Chronic kidney disease can affect your immune system and increase your risk of stroke and heart attack. Some people may experience a numbness or tingling sensation in their hands or feet, or swollen glands in the face. These signs can also be caused by other illnesses. Number 3. Dizziness is considered a kidney problem? Yes, you heard me right. If you are wondering why dizziness is considered a kidney problem, it is because kidneys play an important role in your health. Simple. When your kidneys fail to function properly, toxins build up in your body. As a result, you may experience dizziness, nausea, or fatigue. This can lead to metabolic complications such as hyperphosphatemia, hypercalcemia, and uremic toxicity. Kidney failure is a serious condition. It is also life-threatening. You may need dialysis or a kidney transplant to treat the disease. Kidney failure is usually caused by a series of medical conditions. Some of the leading causes include high blood pressure, diabetes, and heart disease. Other conditions include cancer, tumors, and infections. Fortunately, there are treatments available that can help manage the condition. In a healthy person, the kidneys produce a hormone called erythropoietin. The hormone tells the body how to make red blood cells and oxygen-carrying cells. When the kidneys fail to function, this hormone isn't produced as effectively, so there isn't enough red blood cell production. Because the body doesn't have as many red blood cells, it doesn't receive enough oxygen to its muscles and nerves. Number 4. Urine tests, nausea and vomiting as signs of kidney disease. As discussed earlier, when you have kidney disease, you may experience nausea and vomiting. This is because of waste buildup in your blood. Urine tests can help to detect these symptoms, as well as other changes in your body. Depending on the severity of your condition, your doctor may want to test your blood and urine for certain substances. Your doctor may also want to make lifestyle adjustments to help you deal with kidney disease. Kidneys are sometimes unable to remove waste, which can cause a high level of urea and nitrogen in your blood. Urine tests can help diagnose kidney failure. Another symptom of kidney failure is inflammation. If your kidneys are unable to properly remove toxins from your blood, you could experience a skin rash, shortness of breath, and swelling in your lungs. A urine test can also show if your blood has too many electrolytes, such as sodium. High sodium levels can cause blood pressure to increase. Similarly, low potassium levels can cause muscle cramping. When your kidneys are not working properly, they produce too much parathyroid hormone. Parathyroid hormone helps to keep calcium in the blood. However, too much parathyroid hormone can weaken bones. Number 5. Kidney disease rash. Rash. Exactly. A kidney disease rash can be an unpleasant symptom. Symptoms include swelling, itching, and dryness. However, there are treatments available for it. Trust me, if you or a loved one are experiencing symptoms of kidney disease, you should contact a healthcare provider as soon as possible, especially if any rashes could encounter. Itching is a common symptom of kidney failure. People who experience itching are usually dialysis patients, though it can occur in anyone. Itching can cause blisters and other forms of rashes. These can appear as small bumps that can join to form rough, raised patches. As the rashes clear, scars may form. The American Kidney Fund provides a guide to managing itching. Topical creams or antihistamines are often used. Antihistamines should be taken before bedtime, and should not be used while driving. You should also avoid perfumes and aftershaves. In some cases, a rash can form around the joints. Calcium deposits can also occur. Typically, these deposits are not painful, but they can cause a rash. Other skin conditions that may affect people with kidney disease include xerosis, hyperpigmentation, and dry skin. A dermatologist can advise you on treatment choices and drugs. Please take this seriously. Number 6. Constantly feeling cold with a sign of kidney disease. There are many reasons why a person can feel cold. Some of them are normal signs of aging, while others are due to health problems. If you feel constantly cold, you should visit a physician. One of the most common reasons is low iron levels. Your kidneys are responsible for filtering the blood and maintaining a healthy balance of minerals. Another reason for a cold feeling is a low red blood cell count. The lack of red blood cells in your body can lead to oxygen deficiency, causing your hands and feet to feel cold. Coldness can also be caused by high blood pressure, anemia, or diabetes. Diabetics can experience peripheral neuropathy, a condition characterized by coldness, cold feet, and pain. It can be treated by treating the underlying cause. Getting treatment early can help to avoid more serious issues. Keeping track of your symptoms can also help you to find out if you have a health problem. Always, use your kidney guide to ask the right questions to your doctor. Number 7. Urinary difficulty a sign of kidney disease? Chronic kidney disease affects 37 million Americans. When a person experiences urinary retention, he or she cannot empty the bladder completely. Urinary retention can occur suddenly or gradually. If you experience a sudden or chronic inability to pass urine, it's important to seek medical attention immediately. A doctor will diagnose your condition, and he or she will also prescribe a treatment plan. Urinary retention can be caused by an injury to the pelvic floor or by a blockage to the urethra. Infections or other problems in the urinary tract can also cause this problem. Medications can also cause urinary retention. Benzodiazepines, antidepressants, nasal decongestants and some blood pressure lowering medications can affect the urinary system. Anticholinergic drugs are used to treat muscle spasms, but can also have side effects that can interfere with bladder control. Some people don't realize they have this problem until it causes serious health problems. You can take steps to slow down its progression, including dietary changes and exercise. In addition, your doctor may recommend speaking with a nephrologist. Acute kidney failure, or acute renal failure, is when a person experiences a rapid decline in kidney function. The condition can be the result of a sudden injury or a severe illness. People who suffer from kidney disease often have to go to the bathroom often. They can have a bad taste in their mouth, a metal taste in their breath, and an aversion to protein foods. Kidney problems can cause fluid to accumulate in the lungs. Takeaway: kidneys can also help maintain a person's bones. When bones are healthy, they're strong. Calcium and phosphorus are minerals that are important for the strength of the bones. To keep a kidney healthy, you should maintain a balanced diet. As simple as that. A diet that contains fruits, vegetables, and whole grains will reduce your risk of chronic conditions. Be sure to drink plenty of water. You should also try to stay active most days of the week. Kidneys are very complex organs. If they're damaged, they can no longer perform their usual functions. There are no cures for kidney disease. However, dialysis can help slow its progression. Alternatively, a kidney transplant may be possible. Survivors of a kidney transplant can lead long, healthy lives with just one kidney. Dear viewers, we believe that seeing this video would have piqued your interest and sparked your curiosity. We'd appreciate it if you could leave us a remark in the comments section below. As always, we appreciate hearing from you.